Yeah.
Okay.
Is it very loud?
Begin. Okay.
Okay. You're an FY2 in GP surgery. Mr. James Adam has come to you with some concerns, age 66.
It's weird that like the reason why people having panic attack and why they lean into it. I always think
Let me fast forward.
okay, well, I can have ventilation and we can see what's going on. Just give it
Enter the room. Hello, examiner. I'm Dr. Gulkati. My GMC is 801187. May I proceed? Hello.
Hi.
I'm Dr. Gulkati, one of the doctors in the GP today. And you must be James Adam, right?
Yes,
Could you please verify your age, please?
I'm 66.
Is it okay if I call you James?
Yeah.
Well, James, nice to meet you.
Okay.
How
Nice
may
to
I
meet
help
you
you
too.
today?
I'm really concerned that I might die of an aneurysm.
I'm so sorry to hear that. Like, is there any particular reason that why you were worried about this?
I just recently lost my brother and one of my friends, and both of them had an aneurysm, and apparently it just blew up, burst up, and then they died. I was afraid that I might have something similar.
I'm so sorry to hear about your brother and your friend. How are you doing?
I mean, I'm doing in what
Emotionally, how are
terms?
you
I mean,
coping?
it's okay. But I'm just really worried that if this happens to me as well.
Okay, so to have a better understanding, would you mind if I ask you a few questions?
Sure, go ahead.
So, do you have any tummy pain?
No,
Do you have any back pain?
no,
Okay. Do you have any medical conditions
like
like high blood pressure?
I do have hypertension.
Are you taking any medications?
Yes, one pill.
What's the medication that you're taking?
I don't know. I think
Okay.
it's.
Are you taking it as per prescription?
Yes, I
And
am.
is it under control?
Yeah, I'm having it fairly under control.
Okay, fine. And any other medical conditions like diabetes, high blood pressure,
No,
any blood vessel related conditions,
not that I know of.
any other medical conditions that you could just remember?
No,
Okay. And are you feeling dizzy?
no, I'm not.
Do you have any headache?
No,
How's your urine? Is there any blood in it?
no,
Are you feeling any racing heart?
no.
Any breathing difficulty? Any cough?
No, I'm not having any of this.
Any loss of weight? Any loss of appetite?
No,
Lumps or bumps anywhere else in your body?
no,
Did you notice any rash anywhere in your body?
no,
Any bruises?
no.
Anything? And, do you have any other concerns apart from this?
No, it's just this. I just want to make sure that I don't have this. Don't have an
I
aneurysm.
understand. And do you have any other expectations regarding this concern?
No, I just want to know like how I can just make sure that I don't have one.
And are you on any medications?
Just for the hypertension.
Okay, any other medications? Any supplements? Any herbal medications? Okay. And anyone in the family with any medical conditions that relates to blood disorders? Anyone died early?
Well, I mean, nobody else.
Like you mentioned, your brother had like
Yeah, I
what?
mean, he had.
What sort of symptom that is he your biological brother?
Yes, he is.
And what sort of symptoms that he had?
But I don't remember him having anything particular. We all thought he was really healthy. In fact, I was the one who everybody thought would die first. But, I mean, even then, we didn't expect me to die this young. Obviously, it was just like when we would be old, it would be me who would pass away before him. And then, like, he just died so young. It's just concerning me now.
Do you smoke?
Yeah, I do.
How much would you smoke?
Well, I smoke like 20 cigarettes a day.
And how long are you smoking?
For the past 20, 30 years maybe.
Any alcohol?
Very rarely.
Any recreational drugs?
No.
Is this a thought making you anxious? How's this affecting you? How's this thoughts affecting you?
I mean, obviously, I'm really concerned.
Okay, how
about this.
is it like bothering you that you're not able to do your daily functions?
Well, not exactly, but yeah, I mean, it's my prime concern at the moment.
Okay, thank you for answering the questions. Now I'd like to examine you.
Okay.
I'd like to examine, check your observation that includes the blood pressure, pulse, temperature, blood pressure, oxygen levels in your blood. And I would like to listen to your chest. And I would like to do some examine your tummy, back passage. Okay.
Observations and examinations are normal. Blood pressure is 133/89. All other assessments are fine.
Okay. And I would like to do some blood investigation. I'm that includes CBC, ESR, CRP, kidney function test, liver function test, and ultrasound of abdomen. Okay. So now.
Blood results are awaited.
Okay. Thank you
You are
for
in the GP, so ultrasound cannot be done at the moment.
Now, from my assessment,
2 minutes remaining.
I could not, apart from high blood pressure and your smoking history, and your brother was also having. You mentioned I don't have his medical record as we speak, but still you mentioned that he had this abdominal aortic aneurysm. So what we're going to do is like we are going to do some ultrasound tests, see how is is there any. So we will check for that. But as we speak, you don't have any signs or symptoms suggestive of aortic aneurysm. Do you understand?
Yeah.
Any other questions?
No.
Okay. So what I'm going to do is, since you're having this family history, otherwise we would not even. I would highly recommend you to keep your medications under control. Your BP is still fine, still on the higher border, but still it's okay. We would follow up after 2 weeks, and we would see how your BP is doing. Otherwise, you don't need to do it. And we would highly recommend you to quit smoking, just smoking, and also, if at all you're having any abdominal aortic, it can make your blood vessels weak and could cause rupture. So for that, I can suggest smoking cessation clinic. Does that sound good?
Yeah.
Okay, because that would really help you.
Well, if that helps me. Okay. And what else can I do for you?
And if
When will I have the ultrasound?
you will have ultrasound. We'll be getting back to you once you get a date from there. So you should be like, we are not doing urgent ultrasound because I don't see any immediate reason to do so. And we'll have a follow-up after ultrasound. Does that sound good?
Yeah.
And if you feel like you're having severe tummy pain, or is any pulsatile mass in your tummy, or if you feel there is a lot of blood, or if you feel dizzy, please go to the nearest hospital.
Okay. Well, my friend's brother got a screening test for the aneurysm. Can I not get the same thing?
Move on to the next station.
Time out.
Okay. I mean, you did fine in terms of how you did the history. I think there are still questions that you could have asked, like diet, physical activity.
No, I totally understand, but like how diet is important.
Because what is the management that you can give for someone who's at risk of aneurysm? Say if he had or he has a risk of aneurysm, what is the advice that you can give in a GP? It is lifestyle
not
advice.
strain.
It is lifestyle advice.
Okay.
Yeah, so you counsel them on like hypertension management, lifestyle advice, which would be being more physically active, taking care of their diet, smoking cessation. So these questions, in all cases that involves like the heart, blood pressures, counseling, smoking, alcohol, drugs, diet, physical activity is very important. Also in general, I have seen you ignoring the question on diet in most situations. You have very, very rarely asked them. You're very, very rarely asking diet or physical activity. So yeah, you need to take care of that. So yeah, so diet is very important in history, and physical activity is important, because he is a person with, like, one of the reasons why my friends or family used to make fun of the fact that I would die earlier is because of how fat I am. So yeah, I am an obese person. I don't think you asked for BMI in the observations and assessment. So yeah, so those things I would consider should be done. And it's clear from the blood pressure that I've given that he's not completely like, I mean, he's not high blood pressure, but it shows there's a possibility that he might be taking his medications, but other
There is
factors
something
like lifestyle or
stress.
body, no, not stress, I would say his BMI, lifestyle, eating habits, smoking, none of these have changed. So it's just on the medication that he is functioning. If he's still smoking 20 cigarettes in the last 30 years and he has had hypertension for these many years and he hasn't stopped smoking, that means he is not someone who's looking at the lifestyle part of his hypertension. So these are the things that you need to pick up from your consultation. In terms of like, so one of the key things to understand in this scenario is like the age 66 was very specifically designed because in the UK, everyone who's above 65, they can self-refer themselves for a national screening program that screens for abdominal aortic aneurysms in males.
Oh,
So there is a screening program for that. So one other alternative way that this station can come is someone who's had the screening and has come to you with his results. Okay, so what happens in the screening program is that they are screened for an aneurysm and then they get a scan and then you have like there's a measure of how big the aneurysm is. So you could have 3 findings in the screening. It can be small, medium or large. So if someone has a small aneurysm, then what happens, they'll come in the GP for a discussion on the report. Then what you should tell them is that they will have 12 monthly check of ultrasounds to see if the size is growing or not. Okay, so if the size grows, then they'll have a specialist referral. If someone has a medium sized, then they get an ultrasound every 3 months to see how the size is growing or not. If it enlarges, that is, it goes more than 5.5 centimeters, then they get a specialist referral. If someone has already got a large aneurysm on their screening, then they get referred in a 2-week referral to the vascular surgeons to be seen and further tests are done for them. You need to tell them the management of aneurysm definitive plan is a surgery which would be decided by the vascular surgeons, but not everyone needs to go for a surgery. Another way this case can come, like a PSA case, is that someone might have the result and they might be like, can I have a surgery for my aneurysm, coming with a small or a medium set. So your aim in that station would be for you to like do the history, look at everything and counsel them that not everybody who has a scan showing a small or a medium should have a surgery. Should discuss about the risk versus benefit of having a surgery. Tell them that sometimes if it's a small or medium aneurysm and if it's not growing in size, not causing any problems or any symptoms, and if he's doing his lifestyle modifications properly, it's more riskier to have a surgery and that surgery to impact in bad or worse outcome than not having a surgery. The other thing is, so once you counsel them for small and medium things, the lifestyle and other GP counseling you need to do is in terms of lifestyle, where you tell them that you have to cut down on smoking, regular management of blood pressures. Even if the person is not hypertensive, you need to ask them to have more regular BP monitoring to check that they're not going into hypertension. Advice on healthy diet, physical activity, lifestyle, regular exercise, weight loss, and if they drink alcohol, to limit or bring that down. Need to give them a leaflet on different types of abdominal aortic aneurysms so they can read more about it. The other more important thing is this has to be informed to the TBLA. So if you have a risk of abdominal aortic aneurysm and if your size is 6 centimeters and you're a car driver, you need to inform the TBLA. If it's more than 6.5 in a car driver, you cannot drive. Your license will be suspended. And if your aneurysm is more than 5.5 and you are a lorry or a truck driver, then your license is suspended. So this has got a TBLA component, which is quite not something we might expect, because why would an abdominal aneurysm have a TBLA side to it? So yeah,
I do understand, but
so this is just a golden point because we wouldn't know. In history, what you need to focus on is like current symptoms, so to check if they have any risk of ongoing aneurysm, ongoing bleed, ongoing rupture, risk, and obviously there should be a detailed history on risk factors like medical conditions, medications, smoking, diet, alcohol, physical activity, those things. I think a couple of other risk factors that you need to look out for would be.
so how would I ask if they have abdominal aortic aneurysm? Any tummy swelling? Any pulsatile
I mean,
tummy?
I think
Any back pain?
someone's got like a proper pulsatile tummy. They wouldn't really be coming to the GP. They might be in a situation where
It is
they
an
need to go
emergency.
to the A&E. But yeah, so for screening, yeah, so you just ask them about like COPD, hyperlipidemia, hypertension, cerebrovascular accident, coronary disease, peripheral artery disease,
Straight
family
away you
history.
go to
So
past
family
medical.
history of AA is also important. No, these are like, yeah, I mean, not straight away, but see, this is a different person. This is not an A&E person coming with a suspected aneurysm. This is a person who's coming with a concern of aneurysm. So obviously that person is not having an aneurysm, but you still need to rule out if he's having an ongoing one. So your first target would be to make sure he doesn't have one at the moment. So quick red flag symptoms of aneurysm. Then you go into past medical history. Another thing you can do is like diagnose a bit about what he's spoken to you already about his friend and his brother. So make sure.
There is no point in friend probing friend, right?
No, I mean, you don't have to look at their history, but you can just ask like very slight questions, not really about their medical history, because that's not something you're expecting him to say. What you need to ask him is like, you can ask like, how did you know it is an aneurysm? You can check his understanding, like what does
What's
he
your-
know about aneurysm? Like why is he so he's just concerned because two of the people he knew very closely suddenly died, and then what they had was an aneurysm. Does he know what's an aneurysm? No. So you didn't explain that. You assumed that I knew what I was talking about. I have no clue what I'm talking about. So you need to ask, like, do you understand what an aneurysm is? Either in the beginning or in the end when you discuss your management. Um, yeah, and then
I think it's in the beginning because somebody is worried about something. I think it's best to ask what is
yeah,
there.
it is. It's. I think it's up to you. It's about how you would want to devise or take your station forward. So you can ask that, and then you can be like, okay, so I'm going to assess. You can ask that, and you can say, okay, there are certain things that can put somebody in the risk of having an aneurysm. Do you mind if I ask you a couple of questions just to see how it is with you and your health? Or you can be in the end. You can say, okay, so do you understand what an aneurysm is? And then you can explain by saying, you can start your management by saying, this is an abdominal aneurysm, and these are the risk factors for somebody having an aneurysm. In your case, you have these risk factors. So that gives it more like, it gives a very holistic explanation. So you can be like, okay, so this is what an aneurysm is, and these are the risk factors for having an aneurysm, and these are the symptoms of someone having an ongoing aneurysm or bleed. And in your case, I can't find any of the ongoing symptoms, so I'm not concerned at the moment about you having one at the moment. But you do have certain risk factors that increases your chance of having an aneurysm now or in the future. And then you can say you are. So this point was something I don't think you were aware of. So you can say like you're 66. I would like to let you know that there is a screening program where every male is offered an option to have an abdominal aneurysm screening done after they're 65 years old. And this is a self-referral option, so you can refer yourself for the screening program. And then you can say like these are the lifestyle modifications, these are the things. All right.
National
Screening program. So there are only like 5-6 conditions that has like a screening program. So one is cervical screening, one is breast cancer. I think ovarian is there, but it's like an optional thing. You have, I think, routine screening for abdominal aneurysm and gastric cancer. Just need to check up. There are like 5 or 6 cancer that has screening, and this is something you need to learn for the teaching station of cancer, suspected cancer and cancer screening program. There are 2 teaching stations on cancer, suspected cancer and cancer screening. So cancer pathways, I think.
Yeah, cancer pathway.
Yeah.
Oh,
So
do I
these
have
are
to
the things
learn
that
this
you need to
thing?
learn about it. What would you otherwise explain about them? So you should. These are the things that you need to explain in the cancer pathway. Like what are the things that have routine screening? What are the things that do not have routine screening? What are the first-line investigations we do for common suspected cancers? How the pathway works? If someone is seen in GP, someone is seen in community, someone is seen in A&E, what would be the next step? So these are the things that you need to teach in the cancer pathway station. Right?
So, Abdominal Aortic Aneurysm, National Screening Program. Then I did miss